Hey guys, it's Karen and it's the time we've all been waiting for, seeing what my eyes look like after having the steri-strips and the stitches removed. So I had them removed late yesterday afternoon. I did already, the steri-strips had already mostly fallen off. I only had one left there and one in the inner corner on this side, and so I could pretty much see my eyes before I went in to get the stitches out. And I have to say I was disappointed yesterday, and I'll put the before and after photos I think at the beginning of this so that you can see and, you know, make an opinion. And I've put them on Instagram. If you watch me on Instagram, the photos were there, and I did a little story saying, you know, that I was disappointed before I went in, and then I was still quite disappointed when I came out. And a lot of you can see what I'm talking about. In fact, nobody said they can't see what I'm talking about, but a lot of people are putting it down to swelling, and I don't think it's necessarily that. So where do I begin? Let me tell you about getting the stitches out. Did not hurt at all, but somebody did comment on Instagram that she found the stitches removal the hardest part. For me, it was just one stitch. I think I explained when I had it, it went in there, there was one point it was in there, and then it exited here. So there was just 3 exit entry points on each eye. And really it was the steri-strips that were doing the work, and the stitch was so small that I was trying to point it out to Kevin. He couldn't see it. I could see it because it was actually in my field of vision, because the steri-strip came off and it was sort of pointing out like a little antenna. And Kev couldn't see it. He actually couldn't see it. I could see it was blue. And so when they came out, I could feel it, you know, go over the top of my eye, but it wasn't painful at all. It wasn't in any way bothersome. So I thought I was seeing the nurse and the surgeon yesterday, and when I arrived I said, oh, I've got an appointment, and they said it's with the nurse, but the surgeon might pop in and see you. So I was like, oh well, that's fine, I can at least ask him, you know. So I saw the nurse. She just removed the stitches, said that everything looks really good. She said, but at the corners of my eye here, it's not completely knitted together. So she's put some more steri-strips on. So I've got 2 on either side. I have to keep these on for 3 days. And she said, if they fall off, don't worry about it. But if not, I can take them off after 3 days. It's just to make sure everything knits together perfectly. She said, I look like I have less bruising than most. I'm healing quicker than most, which is amazing, really. With having Ehlers-Danlos, it normally takes me longer, and I normally have more bruising. So, you know, I feel like the surgeon was really good, but I'm also in quite a good state of health, and I can't wear makeup until Christmas Day. So yesterday she told me 2 weeks, so that will be Christmas Day that I can wear makeup. So that will be my present to myself, is trying out some new makeup. I'm actually enjoying the extra time in the morning, to be honest, not putting on my makeup. I showed the nurse the silicone gel that I bought, which is this. It's called Dermatix, and she said that yes, they would be happy for us to use silicone gel, and that, you know, they do think it might be mildly helpful. But she said, you can already see that I don't have any problems with scars, so there's really no need to use that, but that I can use it if I want after 3 weeks. So I guess Christmas Day as well, because she said 3 weeks after surgery. You don't start any gels before then, because you need to make sure that it's not actually getting into the skin. You know, it needs to be completely closed up. So I can start using that if I want on Christmas Day. I don't know whether I will or not, because, you know, the scars don't look like they're going to be visible hardly at all. Okay, so let me put those before and after pictures in again and tell you what I see. So I think that the hooding is exactly the same, and I felt like there's no more of my mobile lid, meaning my, you know, my actual eyelid visible, than there was before. I suppose on my right eye, so as you're looking at it on your left, there is a tiny bit more of my eye showing, like from the inner part. There is a little bit more space there, but very, very minimal. And how I was expecting my eyes to look was, in fact, I can show you, because do you remember I said the steri-strips fell off? And there was one on the inner part of my eye still, and that's how I was expecting it to look. So I'll put that picture in. See how there's one steri-strip there, but you can see more of my eyelid, and there isn't an actual fold of skin. There is still some loose skin, but it's actually being held back by that steri-strip. And that's how I expected my eyes would look. I knew that they wouldn't be perfect. I knew that they wouldn't be, you know, it wouldn't be straight down and completely smooth with my eyes open, because I do have a natural crease in my eyes, but that's how I expected it to look. So the nurse asked me how I felt about everything, and I told her that, you know, I was really delighted that I didn't seem to have much bruising, and that everything was going well healing wise, and that I had slept no problem. I hadn't had any pain. I didn't have and don't have watery eyes, which was kind of a concern, because I do, you know, sometimes suffer with really watery eyes. It sort of goes in phases with me. But that I was disappointed in the results that I could see. And I was asking her, you know, could I see, would there be an improvement, or was this the final, not the final result, because I can see that there's redness and there's a little bit of bruising to go away, but would it look any different in shape? Because every photo that I've looked at of people that have been through blepharoplasty, you can see how much skin has been removed and you can see the result, but you can see that there's swelling. And on me, I didn't feel like there was any swelling. It doesn't feel like my eyes are swollen, because when your eyes are swollen, and I've had swollen eyes before, and of course they were swollen at the beginning, they feel very tight, and then my eyes don't feel tight anymore. And so she said that she can see some swelling on my right eye, but not on my left eye. She said, I can see just a tiny bit of swelling on your right eye. And she said, actually, even though the right eye looks worse bruising wise, she said that one is actually healed a little bit better, but there's still a bit of swelling there, but she can't see any on the left. And she asked me to sit up and she wanted to have a look at my eyes, and she said to me, I do see what you mean, you do look like you've got hooded eyes. So she said, let me see if the surgeon is available, because he's just next door and perhaps he can reassure you, you know. And I said to her, no, don't worry, you know, because I didn't want to disturb the guy. And what she'd said to me was, if there is any issues with your eyes and they need a revision, so you need to have it done again, he won't even consider it until your appointment in April, when you are completely 100% healed, you know, your skin has kind of regenerated and enough time has passed that we can see what the scar's doing, etc., etc. He said only then will he even consider a revision if there is too much skin there and he's been too conservative in his operation. And I said to her, you know, if it turns out that he's been too conservative, that he's not taken too much tissue for fear of my eyes not closing, I'm okay with that, as long as, you know, he says that. I'm really okay with that, because it's much better that he takes too little skin than too much skin. And I was sitting here telling you I've got problems closing my eyes, because I know that that's a risk. They have to get the balance between taking an amount of skin that will produce a cosmetic effect and not causing you to have problems closing your eyes. And you may remember on day one, only for the sort of middle part of the day, but I couldn't close my eyes. Immediately after the operation, I couldn't close my eyes at all. And then I found that I could close my eyes in the dark. And so I could see how that could happen. So I felt a lot better because the nurse could see what I was talking about. You know, I felt like she sort of verified that I had a genuine concern, and she wasn't like, oh, it's only a week. There's no way of telling. She knew exactly what I meant, and she's seen a lot of blepharoplasty patients, and she said, yes, you can normally see that there's swelling, but you can also see that there's more skin been taken, you know. And she said there is some loose skin still there, and she said, but I'm not a surgeon, so he might be able to reassure you more. And I kept saying to her, no, it's all right, I'll wait and see him till April, because there's no point, I felt like there's no point seeing him if he can't do anything just now, you know. I might as well wait until April, and then I can say, right, okay, what now I can show you, I could start touching my eyes at that point, you know, and saying, look, there's excess skin, you can pinch it, because that's how they test if there's enough skin to take away. They have to be able to pinch and pull the skin out without pulling your brow right down and without lifting your eyelid open. So if you want to see if you are a candidate for blepharoplasty, close your eye and just pinch in the middle of your skin and see if you can pull skin out. And you'll need to keep one eye open, or you'll need to video it or something and see if it pulls your eyebrow down. So the nurse, being as lovely as she was, she insisted that I see him and that I wait for him. And I said, oh, you know, I don't want to hold you up. But she said, oh, don't worry, I've not got a clinic for half an hour. And so we just chatted. We sat and chatted for nearly half an hour it was, because he had a patient in. And so we were right next door, and she was listening for when the door was opening so that she could ask him to pop in and see me, bless her. And it was nice because it ended up, we knew a few of the same people from, you know, when I worked in the other hospital, etc. So it was nice chatting to her. And actually it sort of calmed me down, just having a chat about other things, because you know, when you're getting really worked up about something and really passionate about something and really hopeful, I had a big concern that I was going to be in floods of tears in that appointment. I had said this to Kev, because I could see what my eyes looked like. I just felt like, oh no, don't tell me it's, you know, it's just not going to work for me or whatever. So I was worried that I was going to be upset speaking to the guy. Anyway, so he came in and said, you know, the healing looks great and everything. What do you think? And I said to him, I feel like They look the same as they did before. I said, and I have taken a photo, and I took another photo during that time as well when I was showing the nurse, and she said, yeah, they do still look hooded. So I showed him, and he said, it gave me kind of a couple of reasons. Firstly, he said, well, you know, it is about finding the balance between taking enough skin off and your eyes not closing. And I said to him, well, I understand that, and I can see that you've obviously taken some skin off, but my eyes in these pictures look barely any different. And he said, well, there could still be some swelling going on underneath. But you know, when you could just tell the way he said it, that he wasn't like, yep, it'll still all be swollen, that will go away. He was saying there could still be swelling going on underneath. So he obviously couldn't see swelling either. And he said, we can't really judge until it's fully healed. And I totally appreciate that, I do. But he said, the other thing is, he said, there is brow compensation. And I was like, brow compensation? And he said, when you've got a lot of loose skin here, your brows sit like, say they're sitting like they are now. He said, but sometimes when you take the skin away, the brows can be pulled down because the skin is tighter, and therefore you then have got another lot of loose skin sitting over the eyelids. And I just sort of said, oh, okay, I didn't really understand what he was talking about, and I had to sort of process that afterwards, you know. But when I thought about it, I thought, if that's the case, he should have told me that beforehand, number one. He should have told me that there is a possibility of brow compensation, and if that happens, it could look exactly the same as it did before, but just your eyes will be in a different position. So basically, instead of my eyebrows being like that and hooded, they're like this and hooded, if you know what I mean. Everything's just short. That's even worse, to be honest, than starting off with just hooded eyes, but bigger eyes, or bigger eyelid space. So that was my first thinking on that. And the second thinking was, from everything I've looked at, and even he told me, the idea is, like I said, that you pinch the skin and make sure that it doesn't pull the brow down and that it doesn't close the eyelid. So that would mean that it would almost mean he took too much skin and it was pulling the eyebrow down. Honestly, I don't think that's happening, because I'll show you a picture of my eyes closed. I think the scar, relative to other pictures I've seen, is a lot lower than I was expecting. I was expecting the scar and the sort of crease line to be a lot higher. And I think that that's where the issue is. Now, you might think, well, who do you think you are? You know, and you'd be right. You know, who do I think I am? I can only make an assessment on what I think, and it's only an opinion, and it's not, I admit, it's not an opinion coming from knowledge or experience. It's simply coming from what I see and what I can figure out. But my opinion is that part of the reason I've healed so well and had, you know, less bruising, etc., is that he is more conservative with his surgery, because he did talk a lot about being conservative. And if you think the bigger the wound, the bigger the area, so if you've taken out that amount of skin and then that wound had to close, there's a lot more bruising with that, there's a lot more healing. But if you take a smaller amount, there's smaller amount of skin to be knitted together. I don't know if that makes sense what I'm saying. So I feel like he has maybe been too conservative. I hesitate to say he's put the line in the wrong place, because like I said, I don't know that. It's just me looking at it compared to other photos. It looks really low to me, but I know that also everybody's got a different eye shape, and so there may well be a very good reason for doing it that way. You know, there probably He was very sweet. You know, he gave me a hug and was like, I'm sure it'll be fine, don't worry about it, you know, we'll have a look at it in April and see what's happening. And the nurse was saying to me, you know, don't worry about it, if there is anything that can be done, he'll listen to you and he'll do it, you know. So that was a little bit reassuring. You know, they were both just saying, whilst they could see the issue, they can't make a decision until April, and they can't make a final opinion until April, which is totally understandable. So like I said, I came home, I was upset, and I've been desperately trying not to get upset about it, because it feels ridiculous to be upset over this, because I'm like, it's vanity, you know. And it is just the case of, you know, when you think you're going to get something and then you don't feel like you've gotten it. It's that, you know, it's like I was perfectly fine without this until until Kev suggested that we could afford it from his bonus, you know, and I thought, but now I'd got myself all excited, but I just thought, what a silly thing to be crying about, you know, of all the things that I've suffered in my life, all the things that my friends have suffered, all the things that are going on in the world. I can't cry over vanity, you know. I was just getting more and more annoyed, but then I was getting more and more upset. But of course, my hubby was just amazing, and he wanted to see the photos, and he was saying, and he was looking at me, he was like, right, let me see in this light, let me see in that light. And he said, no, I said, I do see what you mean, absolutely, they're still hooded. But in the pictures that one particular picture, which I put up again, he was saying that in that bottom picture, he thinks there is definitely a difference on the inner part of the eye. So I was like, fair enough, that did make me feel a bit better, because I could tell he was being honest with me, you know. And he said, the other thing is, he said, although you have still got a crease of skin, he said, you've still got the same hooding. He said, it actually looks a lot smoother. It's not a wrinkly hood, if that makes sense. It's a smoother hood. And that made me feel better as well, you know. And I thought, and that does suggest that it may be a little bit of inflammation as well, because the thing that makes me think it's, or made me think it's not inflammation, is there's a wrinkling in the skin. Do you see this? And normally inflamed skin or swollen skin is sort of puffy and a bit smoother actually. So he made me feel better, and he was like, you know, and I was saying to him, oh, you know, I feel bad because he got this bonus and he wanted to do this nice thing for me, and here I am crying, you know. And he was like, it doesn't matter. And he was like, and if we need to have it done again, we'll find the money. He's so cute with things like this. And he was supposed to be going to, well, he did go to the golfing range. He goes on nights that he's not working late. The night before he had worked till like 10 o'clock. So last night I was saying to him, right, you need to go, you need to go. And he said to me, no. He said, remember our vows, because we had a humanist ceremony and we had some kind of comical vows. So I promised to listen to him talk about golf, or to pretend to be interested. That was what it was. I promised to pretend to be interested when he talks about golf, and he promised to give me a good listening to. This was part of our vows, and everybody thought that was funny. And he said, remember our vows? He said, do I need to give you a good listening to? And I was like, no, you know, this is not going away, and I can talk to you anytime, so go, you know, because he was like, I'll stay home with you. Bless him, he's so cute. So anyway, he made me feel better, and I knew that I just needed to have a little cry and to be a little bit like, oh, why does nothing ever work out for me? Because it seems like whenever I have some kind of treatment or something, like even down to my nails, you know, I now do my nails myself, but they don't stay on, and that's possibly to do with this bloody elastan loss, you know. And it's like nothing, everything that normal people do and go through and love the results, I feel like never seems to work out for me. And I'm always this enigma that people can't work out. Well, you know, the amount of nail technicians that I just don't understand why they're not staying on. And so I just needed to sulk for a night, I think. And today I feel much more positive and much more, like I said, I'm cautiously optimistic. And I'm much more level-headed about it. You know, I had it done. There's definitely been skin removed. I meant to ask him how much he removed actually, because he said he was going to remove 8 to 10 millimeters, and I'd be interested to know if he measured it or if he could guess how much he removed. But I've had it done. There is some difference, you know, even if it turns out to be very little, there is some difference, and I'm very lucky to have had the opportunity to have it done. And, you know, as Kev says, if it is this brow compensation thing, he says we will fight to make sure that he does a revision if that is at all possible. So let me answer a couple of comments that have already happened on Instagram, and what I pretty much know what a lot of you will say. I think most of you will say it's only been a week, you need to wait. But I think I've covered all of that in this video, you know, that yes, it has only been a week, but there's a lot of photos of immediately after the surgery where I feel like you can see a difference. And the nurse confirmed to me that even if it's only a week, you can see the amount of skin that's been removed, and that's where I have an issue, that I feel like there's excess skin that could have been removed. So that would answer that question. A lot of people will say that it's just swelling, but you know, the nurse and the surgeon who have seen many blepharoplasty situations have said that it doesn't necessarily look like swelling, but it could be. So it is a possibility, and I accept that, and that's why I'm cautiously optimistic. Somebody suggested contacting Lisa D1 because she had blepharoplasty. I've actually spoken to Lisa before. Her and I have emailed backwards and forwards, and she was very helpful when I had filler in my lips, which was God, 2.5 years ago now, she'd said to me, start off really slowly. And so that's what I did. And that definitely worked better for me. But I've never had it since. I found it too painful and I wasn't sure I even liked the look. But I understand that that's a lovely suggestion to ask somebody else. But I feel like everybody's situation is unique, and I believe that Lisa went under general anaesthetic and she came out and had sort of frozen peas on her eyes and stuff. So her recovery, because she's gone to, you know, a different surgeon, is in a different country, had general anaesthetic, will be very, very different to mine. Her recovery, her wound healing will be very, very different. But on top of that, every single eye shape is different, you know, so what works and what happened to one person is not necessarily going to happen to the next person, if that makes sense, you know. So whilst I can tell you my experience, you might have a different one. So for example, the girl that left me a comment saying having her stitches removed was very painful. I didn't find it painful at all, you know. But what I was thinking was, I thought, what do I want to tell people? How can they avoid being me? You know, how can they avoid being in this situation? And what should I have done to avoid this? And if it turns out that there is too much skin, I can definitely see there's more on this side, by the way. But if it turns out that there is too much skin and he's trying to put it down to brow compensation, whatever, I was thinking I should have been more specific in asking questions. You know, what we talked about was very vague. Like he kept saying, you know, it's not going to be perfect, but there's definitely excess skin. And you know, I was telling Kev, well, he told me he could take 8 to 10 millimetres. And as Kev was saying, to the layperson, that means nothing. I don't know the difference that 8 to 10 millimetres will make on my eye. What I should have been asking is, you know, will there be any loose skin? Will there be any hooding, or can you completely take away the hooding? And so I think that that would be my advice to you, is really make sure you ask specific questions so there are no surprises or no letdowns, you know, so that you know exactly what you're getting. And he did talk about patient expectations. You know, he said the biggest thing is patients expecting a more dramatic look than can be achieved. And if you look on the internet, the pictures are so varied. There are some that you think, well, it barely looks any different at all. You know, that's about the difference I've got. And then there are others that just look absolutely amazing. And of course, those are the ones I'm focusing on, but they could have a completely different eye shape to me. So now I've just got to sit tight, basically. I know it's only been a week. I know that's what most of you will say. And you're right. I do need to be more patient. And in a way, I hope that I would go in and the nurse would say, I don't know what you're talking about, that's just swelling, and that the surgeon would say, no, that's just swelling, you won't see the final result until April. I still would have been a bit disbelieving though, because like I said, I've seen pictures where I can see a clear result afterwards. But anyway, all I need to do now is try and be patient as best I can. I was a bit taken aback when she said 2 weeks without makeup. It doesn't really bother me in that, thankfully, I don't have any massive Christmas nights out or anything that I need to get dressed up for and go out, because that would bother me, going out without any makeup and, you know, looking a bit bruised and whatnot. And I can put makeup on Christmas Day, which is the first time we've got people coming round, which is great. But the only thing is, I was going to start refilming next week, and I've got New at the Drugstore, I've got a dupe video, and I've got something else. Oh, my microblading experience. I've got those 3 videos already filmed and ready to go up. And so they will go up over the next couple of weeks, sort of in the run up to Christmas. But then I won't have anything filmed. And I did think that I was going to take kind of the Christmas period off. But I'll see how I feel, because I might be itching to film by then. You know, I'll certainly come back and show you what the blepharoplasty looks like once I've got my makeup on and once another couple of weeks has passed. Anyway, I'll definitely come back and do that video, but I might feel like filming then, so I'll see how I feel. But if not, then maybe the Christmas period, that 2 weeks where there's nothing going up other than the odd blepharoplasty video, because it would be nice to just take some time off and spend it, because hubby's off, and you know, we don't have any walkers, etc. So we're going on some nice walks with Watson. Last night after I left my appointment, because I left there about 5:15, my appointment was at 4, I left there about 5:15, and I sent a text to Kev. He'd come home to be home for Watson, and I sent him a text and said, I'm going comfort shopping, speak to you when I get home. I didn't buy anything beauty related, but I did buy this. Look, how gorgeous is this? I went to WH Smith's and I bought lots of doggy magazines and this Follow Your Dreams, They Know the Way. I thought that was quite cute, and I just love a good notebook, so that cheered me up. And I've decided that, being as I can't wear makeup for the next 2 weeks, I will just work on my skin and test things out. So I'm going to have a look and see if I can either use some of the face masks that I've got, or maybe even try some new face masks. And I'm going to trial out some tan. So I have got this one on at the moment. This is the Lavera self tanning cream. So yeah, it's pretty good. It's definitely a light tan, you know, it's a gradual tan, and it's definitely got a tan smell, but so far so good. And then I've got this James Read one, which is 1 hour tan glow mask, face and body. I tried it as in putting it on, washing it off, and there was barely any colour. So I'm going to try putting this on overnight and see what happens. That's the good thing about, you know, I've made sure I've got no appointments that I'd be embarrassed to go out looking if my tan is all patchy or whatever. It's too dark, you know, normally it's too dark for me if I leave something like that on overnight. So, and I might also do some microneedling like above my brow here, because microneedling is something that definitely helps. And I might do microneedling on my top lip, because I definitely feel like even now, I feel like my top lip is plumper after just doing one or maybe 2 sessions with the, excuse me, the microneedle machine. And so I might do that, because that definitely helps plump up my lips a little bit. You know, I've got very thin lips, and I did have to use numbing cream, but it's an ideal time to do it. I mean, I could put makeup on and just kind of go all around my eyes, but that to me would just feel weird to have makeup on and then bruised eyes with no makeup. So I'm just going to wear nothing. I know it was a really long video today. I apologise for that, but I just wanted to tell you every single bit of information I could, because, you know, I know that the reason I'm doing this video is to tell you an honest experience, and I know that there's so many of you out there that, like me, had hooded eyes, mostly by age, I think, and weren't happy with them like me. And so you're either thinking about this procedure, wondering if it's something that you should do, and so the more information I can give you, the better. And like I said, it doesn't mean that it would be exactly the same for you, but you can watch lots of different videos and see lots of different experiences. Anyway, so I hope this has been helpful. I will come back and show you if anything happens in the next 2 weeks, like as in I'm like, oh my God, they look amazing, I'll come and show you. Of course I will. And if not, I will come and show you with a full face of makeup on. May not be Christmas Day, but it may be, because we have a really nice relaxed Christmas Day and our guests don't come over until late afternoon. So I might even come and get ready with me, you never know. So thank you so much for everybody's support through all this again. I know there's a lot of people watching that have gone through blepharoplasty. So if you didn't like the results at a week, but they improved over time, please do let me know, because that will be really encouraging to know. So thank you so much to everybody for supporting me through this, and I'll speak to you again soon.